We're going to talk a little bit about patient outcomes because I think that's really important. There were two different dental cases that came up this week. One made national news, and I kept digging into this story a little bit deeper, trying to understand because actually it hit home a little bit. You can interpret that as you will. But so a dad in Texas went in for routine dental treatment. Take that as you will for those of us in the dental profession. And within 24 to 48 hours, he ended up with sepsis and also with flesh eating bacteria. So he ended up in the hospital. And at the end, he lost several limbs due to this kind of infectious state that started to happen. So he went into the dental office. He had something done. I'm going to assume full mouth probing, maybe a full mouth debridement. His wife even made note that he went in with inflamed gums and then came home with super bleedy gums. And then it sort of escalated into a big sepsis issue. I have no comment about whether the dentist did the right thing or the wrong thing. And I don't have much comment about the patient either, except to say this, because again, this hits home. A lot of patients are very sick when they come into our office, and they're often very sick without us even really knowing it. They may say something subtle about something hurts, or I've been having an issue with something, and it may not really register at the time. But when a body is really fighting an inflammatory and infectious process, and periodontal disease is one of the nastiest ones out there, and we go in with all good intention, all really good intention of trying to help alleviate some of that insult, sometimes we've hit the tipping point for the body. So I don't know what's going to come from this particular situation. I fully expect that this dentist will probably end up in litigation and have to deal with this. But I want to learn something from this. We can't have individuals have adverse outcomes that happen from dentistry and routine care or an attempt to provide good care. We have an adverse outcome and we don't learn something from it because there is a pathology issue, there is an infectious issue and an inflammatory issue. And I'm definitely not blaming the dentist for this particular scenario. I know very little about the clinical environment in which this patient and dentist interacted together. But if we don't learn something, and I only say this because I experienced something somewhat similar with a patient who had low-lying infection when they came in, and it turned into something a lot worse once they left. What was the overlying clinical condition the patient presented with? Rampant perio. Rampant perio, which really required full mouth extraction. And that patient didn't want to pursue that treatment. So it escalated into a situation that was really unhealthy for the patient. I don't think our office did anything wrong. And I don't think our clinic did anything wrong. I think it was just poorly timed interactions between the intention of good dentistry and a body that was really fighting. So we have to learn something from this because I feel for this young man. I feel for the adverse outcome that came from this. I really do. And if there's an opportunity for education and improvement in our protocols on how we screen patients through the periodontal process, we have to learn from that. A few other stories of note for this week. I feel really vindicated with this story. And I know this is going to sound very strange, but there was an individual who died in Florida recently during a full mouth extraction and implant case. And we dentists get thrown under the bus pretty routinely for these particular cases because maybe it was poor general anesthesia, poor conscious sedation, poor health history intake, whatever it might happen to be. But this particular individual loaded up on a bunch of medications before he came in. Maybe or maybe not. The coroner determined he did not disclose the level of medications that he had taken before he came in. And then between that and the mixing of bupivacaine, he had a major cardiac event. Now, the coroner said no fault of the dentist, which How often do I actually get to read that story to say that the dentist isn't going to be charged for this particular adverse outcome? Again, I don't know how to prevent this. If people are loading up on stuff before they come in, taking cocaine, doing a bunch of other things that are really bad for their heart, and then you give them a little bit of epinephrine, we know the adverse outcomes could be there. I'll keep you posted if I have a takeaway message from this particular story. I honestly am just talking about it because I feel a little bit vindicated, because I've told you every week I read the news and it's like some decision that a dentist made that maybe wasn't so great, or, it was a combination of events that led to an adverse outcome that's not going to work out well for the dentist. In this particular case, the dentist has actually been vindicated, which we have to take note. Now, in honor of our particular guest who's here with us tonight, Dr. Stanley, Pearl made the news this week, and I think that's pretty awesome that the company continues to grow and innovate, releasing their clinical documentation platform. I'm pretty excited about this new addition to the Pearl suite of services. They've been doing, as you know, AI radiology interpretation for quite some time. They've started dabbling in insurance verification and AI interpretation of that particular area. And now we're moving into clinical documentation, which I'm really excited about. There's not been a ton of competition in that particular space, so it's nice to see another player or two come online for clinical documentation. This is a juggernaut, and an actual email clinical conversation that we had just today on how we're going to manage the growing requirements of documentation that insurance carriers are requiring of doctors and assistants and hygienists in order to get claims paid. So I'm pretty excited about it. This was released actually just today in a news release. So as Pearl is a sponsor of the show, we hope to get a lot more information coming out in the coming days. We'll be sure to share that with you, especially for our existing Pearl customers. And maybe we can squeeze out a dinky deal for our regulars. And with that, that's the news.